Hi everyone, and welcome to the Citrate Group's presentation for personal protective equipment during the COVID-19 pandemic.
Hi everybody, my name is Carrie Olson and we are going to talk about the personal protective equipment in other countries for COVID-19. First, we're going to discuss the United Kingdom. Their guidelines consisted of social distancing, hand hygiene, and frequent cleaning. I found a really cool slogan called "Catch it, bin it, kill it." And so what it happens is you catch it in a tissue, you throw it away, and then you kill it by washing your hands or using hand sanitizer. The PPE is to be worn depending on where and how you're working. So healthcare and social care workers actually got priority access to PPE, and healthcare workers, when you're touching a patient, you had to wear aprons, gloves, fluid repellent type 2R surgical mask, eye protection. If you're not touching the patient, then just a type 2 surgical mask is required. And then I also found this really interesting. If you're in a patient's home and caring for them, even if you are 2 meters away, they're required to wear type 1 or type 2 surgical mask, gloves, and apron. But notice that no eye protection is required here. And then when in the workplace, in a non-healthcare or social care, type 1 or type 2 surgical mask is required when possible, maintaining social distancing. And the companies have been advised to give their staff more breaks to offer hand washing, so they're continually washing their hands throughout the day. Next, we are going to talk about China. So China, their healthcare workers were not permitted into the hospitals unless they had PPE on. And also I found really interesting about China is they had obviously the COVID positive separate hospitals. They had hospitals just for COVID positive patients. And with the workers and the patients, they made sure they kept them separate by only allowing the workers to enter in through a certain entrance, exit through a certain exit. They had specific hallways for workers and elevators for workers, whereas patients had their other separate elevators, entrance and exits. And I just thought that was really interesting. The PPE required to work in a COVID positive hospital was to provide a scrub suit, complete cover of the dorsum of the foot and ankles with socks covered by plastic wrap, and closed-toed shoes with 2 layers of boot covers, 3 layers of gloves, a coverall, N95 mask, surgical mask, face shield, goggles, hood with 2 layers of head covering, and a disposable waterproof surgical gown. And they got a lot of this reference from the Ebola outbreak, so that is what helped guide them in the PPE that they should be wearing for coronavirus. A lot of these are added due to coronavirus. They weren't all for Ebola, but that's just what I found. I thought was really interesting. And again, the general public to wear face masks and following social distancing and hand washing guidelines. And finally, we're going to talk about Italy. So Italy was hit worst with healthcare worker cases of COVID, and that is because the healthcare workers did not have PPE. They couldn't get a hold of it, and so that made it really vulnerable for the healthcare workers to get the virus. But the healthcare workers were required to wear the FFP2 and FFP3 masks, long sleeve water resistant gowns, and eye protection. And again, masks for the general public were also required.
Hi everyone, my name is Paige Lintemith, and today I am going to be talking about the differences between rules and volunteering for when it comes to personal protection during COVID-19. So the lines between what is considered a mandated guideline or a rule versus something that is voluntary can be a little blurred, especially when it comes to differences between states, what is considered a federal regulation of it, between public events or outings, or even within businesses. Everything is kind of a little jumbled on what is mandated and what is not. So some all around rules that I found included the wearing of masks, which a lot of us know in order to enter a public building, you have to have a mask, or if you cannot maintain that 6 feet social distancing. I actually found a quote from the CDC talking about social distancing, saying that it should be practiced in combination with other everyday preventative actions to reduce the spread of COVID-19. This can also be considered as a voluntarily and not necessarily just a rule specifically, because people do try to follow it and then other ones don't, and it's not something that can be well regulated. Another rule was washing hands for at least 20 seconds and avoiding touching your face. I decided to do a little more in depth with public health care workers because they do have to wear a lot more PPE and take a lot more precautions. So for them, they have to get tested almost every single day before they can enter the facility or the healthcare place that they work. Another thing is that all the general guidelines of the public have to be followed, except with the exception of masks. They specifically have to have N95 masks. Another quote from the CDC I found was that an N95 mask, it had to be a face mask instead of an actual cloth face covering. That should be worn by the healthcare professions for source control during the time period within the facility, which it can be a lot more strict considering everyone there is either immunocompromised or in there for a health reason. Another thing that they mandate is gloves, and they usually have to wear face shields in order to protect that from being spread. A lot of the rules are in place specifically for the spreading of COVID to prevent those respiratory droplets getting spread, even if you are asymptomatic. So when it comes to voluntarily following guidelines or what should be more of a suggestion to wear, again, I brought up that social distancing because you can't really mandate it too well. The only thing we have is other people to come up and ask them to stand 6 feet, and it can get kind of confusing within the public. One thing that I also found was mandating of gloves in the general public. That is because some people do wear gloves because if respiratory droplets get stuck on counters or keyboards and businesses and other stuff. The 2 week self-isolation, if you are in contact with someone who is tested positive for COVID or is in isolation themselves, I consider that one a voluntary because that is using self-discipline to try and mandate that. Volunteering also for staying home as much as possible, try not and go out to like social outings and doing big events. I also looked into businesses because they have to take extra precautions as well to follow the state guidelines as well. So a lot of places have up those plexiglass shields to try and maintain another blockage for the respiratory droplets. Some places even have keyboard coverings and constant sanitization of facilities and other stuff that can be washed. Another thing was making others aware of that social distancing, the 6 feet, of trying to like have those masks and just reminding the general public in a polite, nice way to follow.
PPE is short for personal protective equipment, and it is defined as the equipment that is worn to minimize exposure to hazards in the workplace that can cause injuries and illnesses. As you can see in the image, the typical PPE for healthcare settings are gloves, a face mask such as an N95 mask or a respirator, a face shield or goggles, and a gown. The use of PPE dates back centuries ago when medical physicians and nurses began using makeshift materials during procedures to protect themselves and their patients. Some doctors used sheep intestines to cover their hands, while others used gloves that were made of cotton, silk, or leather. This was until 1844 when the first vulcanized rubber gloves were made. Physicians also used layers of gauze as a face mask to cover their noses and mouths until the typical masks that we see now were created. Here are two previous pandemics and the use of PPE to compare with the COVID-19 pandemic. During the 1918 influenza pandemic, medical professionals were not equipped with the proper PPE to prevent healthcare professionals and other patients from getting influenza. Many physicians even had to use gauze masks when they were with patients that had influenza. During the 2009 influenza pandemic, hospitals received PPE from the Strategic National Stockpile and allocations dependent on the state's population. However, hospitals still struggled with shortages of PPE. Now, during the COVID-19 pandemic, there is still a struggle for hospitals to obtain the right amounts of PPE. Healthcare professionals are expected to wear the proper PPE recommended by the CDC, such as an isolation gown, an N95 face mask, a face shield and/or goggles, and gloves. Patients with a possible or confirmed case, as well as citizens, are expected to wear masks in public gatherings to prevent the spread of coronavirus. Some citizens even have created their own face masks at home due to the shortages.
Hello, my name is Ali. Today I'll be talking about PPEs and how much do they help slow the spread of the coronavirus. The first topic I would like to talk about is if masks help spread or stop the spread of the deadly virus. So there are different types of masks that people started using during the pandemic has started. The mask's main purpose to stop particles from spreading, for example, if someone coughs, the mask stops the drops from spreading into the air and possibly spreading to other people in order to infect them with the disease. There are types of masks that people started using, which is like the surgical, the N95, and the cloth ones. The different types of masks each work slightly different from one another. As you can see here, this is a diagram. It is from the CDC, and it just shows the difference between surgical masks and N95 masks. And it just shows the intended use of purpose and all the other stuff that is needed to help spread the slow of the coronavirus. Okay, the second thing I would like to talk about is comparing and contrasting without and with masks. So in a study that was conducted by the Science News for Students, it mentioned that between 30 and 40% of the people with coronavirus infections exhaled viruses if they wore no mask. So not wearing a mask puts the person at risk by contracting the virus through the contained particles that are floating in the air. However, wearing a mask helps contain the infectious particles and not have them in the air, because the same study also stated that no virus was detected in breaths exhaled through a surgical mask. Therefore, studies from many scientists concluded that wearing a mask helps contain the virus from spreading. It also helps the virus from affecting and entering those who actually wear a mask. Right here, there's a diagram that shows an infected asymptomatic person that doesn't wear a mask and the amount of particles in the air that they exhale out. And then it shows two people. One of them is wearing a mask, which is at minimum to zero exposure, and the other person who is not wearing a mask is at maximum exposure. So person wearing a mask, minimum zero exposure. Person not wearing a mask is at maximum exposure. And then you can see here right below it, it shows the person now wearing a mask, which decreased the amount of particles in the air, but it still shows that person not wearing a mask at minimum exposure, just because they're still not wearing a mask and they still have the ability to inhale those contained particles. There are other PPEs besides masks that helps with the slowing spread of the coronavirus. Another popular one is gloves. So these mainly help the person from touching certain surfaces and areas that may contain the deadly virus, even though many experts say that people don't use gloves properly. However, when caring for someone who might be at risk, wearing a glove might reduce your chance from contracting or passing the coronavirus. So just if you are going to wear gloves, just make sure you are using them properly and to try to avoid as much as possible double contamination. Gowns and other PPEs are mainly used by the hospital when they are caring for a COVID patient. These items help secure that nurse or physician from contracting the virus that may be in the air. So when they enter a room that has a COVID patient in there, the gowns and gloves and the face shields and the masks will help them from the coronavirus from attaching to their body or to their skin. So they mainly help nurses and physicians.
Thank you everyone for watching the Citrate Group's presentation on personal protective equipment. We hope you learned a little bit more about the different precautions that are taken during COVID-19.